Local doctor says this is not enough. He told our Tom Durian about the impact all of this is having on his intensive care unit. Tom.
Yeah, Steve, Dr. Siegel really had a candid conversation with us about the growing frustration he and other critical care workers are seeing right now.
It just came to a head, and I felt the need to say it. I don't know that there was any single specific event that finally pushed me over the edge. But this has been brewing for a long time.
In a Facebook post Sunday, after what he calls a gut-wrenching week-long shift in the COVID ICU, Dr. Eric Siegel lays it all out on the line, saying most workdays in the COVID ICU feel like rearranging the deck chairs on the Titanic. The post continues to rack up shares by the hour.
I put it up because I felt the need to say it.
The doctor works at Aurora St. Luke's Medical Center in Milwaukee and says this time around is different than what they saw in the fall of 2020.
Our impression is that the people that we're seeing are sicker. They're just flat out sicker than they were the last time around. I can't remember the last time I saw an intubated patient survive.
Fueled by the Delta variant, Dr. Siegel says the patients are not only sicker, but younger, and nearly all of them unvaccinated.
Death from anything is never good, but when a 75 or 80-year-old comes in and gets sick and dies, at least you can wrap your head around that. When a 45-year-old who was previously healthy comes in and sick and dies, the tragedy is compounded. And what's just absolutely maddening about it is that this was preventable.
Preventable, Siegel says, with a vaccine, which unlike before is now widely available. His concern goes beyond the welfare of the patients and to his colleagues as well.
You can't just watch people die over and over and over again, knowing that this is almost entirely preventable, and not start to get really pissed off.
The Wisconsin Hospital Association says in southeastern Wisconsin, the number of COVID patients in the hospital is trending downward slightly, with 24 less patients than a week ago. But the ICU numbers are remaining steady. Dr. Siegel worries about what could come next.
Will the next variant be even worse? Will it be one that the vaccine doesn't particularly protect against?
So Dr. Siegel spoke to us as a critical care physician and not a representative of Advocate Aurora, which told us in a statement tonight, while our COVID volumes across Wisconsin have fallen 10% in the past 5 days, Aurora St. Luke's numbers continue to trend up with 54 COVID patients currently hospitalized. They did add that with that higher volume, it does make it a little more challenging to care for the patients, but with the increased amount that they have system-wide of beds, they are able to treat those patients. You can read the entire statement online. Reporting live in Milwaukee tonight, Tom Durian, TMJ4 News.